Okay.
Okay. Good evening, good morning, good afternoon. Rose.
Good morning,
First of all, I
Tova.
keep forgetting to introduce myself. I'm Tova, Dr. Tova Goldfein. This is TMS Roundtable, Global. We are global, like Corona. I know, it's not funny anymore. Rose, good morning in Australia. Would you like to introduce yourself and our guest?
I'm sure I would. Yeah. Now, guests at the round table with us today, we have got Marvin Skorman. Marvin is one of the early Istdp clinicians who has helped us. For me in Australia, he's one of the pioneering people that have allowed us to see understand how the unconscious works. What's the matter?
No, you froze for a minute.
You froze for a second. We were worried. Oh, okay. You're back. Oh, good. Okay. Ladies and gentlemen, thank you for joining us. I'm starting again, if you notice.
Go ahead.
Marvin Skorman has been an early pioneer of intensive short-term dynamic psychotherapy. This therapy allows patients to actually access their unconscious and release those pent-up feelings that they have hidden away, kept quiet, kept down. We've created the theme this morning, for me, in Australia, is not facing our feelings creates even more pain. Now, Marvin is going to actually unpack some of that for us so that we can actually see how when we do hold on to our feelings and neglect them, so to speak, they're going to pop up as fibromyalgia, back pain, sciatica, stomach problems, gastro problems of all sorts, headaches, etc. Marvin, thank you so much for joining us. We really appreciate your company. Now, I just would like to mention that Marvin is close to retirement, he tells us, and hopefully we don't lose him from the scene. Thanks, Marvin, for coming on.
Okay, thank you both for inviting me. Thank you, everyone who's watching. I'm 75. I'm planning to retire at the end of this year, but I closed my practice after 40 years in April of last year, a year ago, to concentrate on teaching and training and getting as much knowledge as I can out into the world. So I'm very grateful to be invited to the show because it's an opportunity to do just that, which I greatly appreciate. Thank you both for inviting me. I'd like to give a little history of Istdp, Intensive Short-Term Dynamic Psychotherapy. Let me do that, make an adjustment here. And open it for questions. And so, or anytime there's a question or a comment, I hope it gets relayed to me. I don't mind the interruptions. In fact, I value them because we can focus on your interests and not just on what I want to say. So very briefly, Istdp was developed by a clinician, clinical professor of psychiatry at McGill University Medical School, and director of the Short-Term Therapy Center at Montreal General Hospital. His name was Habib Davanloo. He was from Iran. He was a colonel in the Iranian cavalry. He was then trained as a surgeon in Paris, and he came to the United States in the early 50s to do a residency in psychiatry at Harvard and Mass General. And the predominant form of psychotherapy then was psychoanalysis. Psychoanalytic psychotherapy.
You mean like Freud psychoanalysis?
Yes, like Freud. That was it. Yeah. And there were adaptations of it, but that's what it was. And the whole basis of psychoanalysis is making the unconscious conscious. And Freud and Breuer and Charcot and the early people who founded the whole profession of psychotherapy found that that was the case. If people could become conscious of their unconscious feelings and thoughts and impulses, that their symptoms disappeared, physical as well as emotional. The problem was that they couldn't get that many people to do it. They tried hypnosis, they tried urging people. People are resistant. We all are. We're resistant to face painful things inside of us. And so they settled on free association, which means you lay on a sofa 5 days a week for an hour with your therapist behind you, out of sight, taking notes. And after 12 or 15 years of that, you were supposed to be cured. I'm sure it didn't happen all that often, which Davanloo saw early on in his work. And so he was resolved to come up with a system of therapy that would bring about the character change, meaning your whole character changes, your whole presence in the world changes, what psychoanalysis was purported to do, but probably seldom did. And he wanted to do that in 40 hours or less. And he is a contemporary of John Sarno. They both started their work in the 60s. I don't know that they ever met each other or exchanged ideas, but they're very parallel. And one of the things that Sarno recommended, I found out, was ISTDP.
Right.
Sarno was for anything that would help people experience
It was done in the movie. It was.
Yes, it was in the movie. That's right.
She was Dr. Irene.
Yeah,
Anyway,
yeah.
she was doing ISTDP with Michael Galinsky. Did you recognize that when you saw the film?
I did.
Amazing.
I did. And when I saw Schubner's film, in Schubner's approach, they have a class where they teach everyone to be a therapist for their classmates.
Yeah.
And I was looking at some of those people who had like a week of training right in the class, and they were excellent therapists, and they were doing ISTDP. And those of us who were therapists who think we're so great because we went through graduate school and got licensed, these people were really excellent therapists just in a few minutes. And so, that's the whole thing, is making the unconscious conscious. In Davanloo, video technology became available a few years after he began his research project, and he videoed all of his sessions. And he would go over them line by line and make a hypothesis and do 5 sessions this way and 5 sessions that way and record those sessions. And his patients came back 6 months, 1 year, 5 years for interviews. And those interviews were recorded, and the patients weighed in, and they would say, you were helping me here, or I was fooling you there. And he systematically compiled all this for probably 14 or 15 years before he went public with it. And John Sarno was doing exactly the same thing and heading exactly the same direction, even though I don't know that they ever met. Davanloo talked about people that influenced him, and I don't know that he met Sarno. He may have, and they may have collaborated some. I don't think so, but I don't know for sure. And so what Davanloo did, see, the problem with therapy and the problem in all of us is resistance. We don't always do what's good for us. We eat too much, we binge watch too much, we worry too much, we work too much, we don't sleep, and we're all resistant at one level or another to facing what's going on underneath. Go ahead.
No, or doing something for us. The worry's doing something for us. And
yes.
The binging and it's giving us something that we think we need, but it's hurting us in the end.
That's right. We keep thinking if only we could earn more money, we'd be happy, or if only our kids were doing better, right? And so that worry becomes a form of pain that we use to avoid facing pain inside of us that we don't want to face. And so resistance is the whole thing. Doesn't matter what kind of therapy you're doing, doesn't matter how you're trying to improve your life, you're going to run into resistance. If there weren't resistance, everyone would read a self-help book and live happily ever after. We would do what was in the book, but we don't. And so in psychoanalysis, the answer to resistance was 12 years on the couch free associating. What Davanloo did is he immediately brought it to people's attention that they were resisting. He called it the major column of defense. And he would say, here's what you're doing right now to sabotage your therapy. And probably you're doing the same thing to sabotage your life. You're being distant, you're intellectualizing, you're emotionally detaching, so I have no idea what you're thinking and feeling, which is what you do in all your other relationships, only here it's live between us, and we can work on it. We're not just talking about it, we're actually experiencing it together in real time and exploring it. Do you want to stay behind that wall? And this could be one more relationship where you don't get out of it what you want. So you're constantly invoking the patient's will. Like, is this really what you want to do? Do you want to spend the rest of your life beating up on yourself to avoid experiencing your feelings? Or can we face what's going on underneath so you don't have to beat up on yourself and have low self-esteem? Repression happens in all of us to one degree or another. And also in the film, it's The Rage.
All the rage.
All the Rage was Gabor Mate, who I highly recommend to everyone. Go to YouTube and type in Gabor Mate, M-A-T-E. But one of the things that he puts so concisely is that if a young child is faced with the choice between attachment and authenticity. We pick attachment and we give up our authentic self.
Can you explain that? That's really powerful. Rose talks about that a lot. Can you explain that, please?
Yeah, because without attachment, see, infants, Freud called it separation anxiety. It's experienced as a death, like you're dependent on your parents to live. And without that attachment, you die. There's failure to thrive syndrome. There's all sorts of things. And so attachment is paramount because you're so dependent on your parents to actually live. You sense that as an infant. You're born with that sense that without your parents, you're going to die. And so attachment is everything. And so if every time you're assertive or every time you feel anger, your mother withdraws or your mother gets punitive, and you realize that your mother's anxiety goes down when you're feeling bad about yourself, you'll learn to feel bad about yourself because at least your mother will be around to feed you and clothe you and protect you and keep you alive. Sorry, go ahead, Rose. What do you want to say?
Very well said. That's all. Very well said.
Okay. Well,
so as an adult, we pick that over authenticity because that's what we know.
Yeah. Isn't it? Yes. And so we learn that if it's just hardwired in, that people will like us if we feel good about ourselves because that's the model we grew up with. It's hardwired in. So your husband comes home drunk at 2 a.m, right? And never called, and maybe he's been with another woman. And I say to the patient, how did you feel toward your husband? And she starts to feel angry and then starts beating up on herself. Maybe if we had sex more often, maybe if I cooked his favorite food more often, I'm not the best wife. I can see why she starts beating up on herself rather than being angry because that's what she learned as a child. That was adaptive as a child. Feeling bad about herself kept her mother in her life so the mother could be there to feed her and clothe her and change her diaper. But when she felt angry, the mother would distance and detach and abandon her. And so she's still doing that. It's like, and it was adaptive as a kid. It's like we build these boats full of defenses that get us across the troubled water of our childhood. And instead of leaving them on the other shore, we pick them up and carry them with us. And they burden
on our shoulders.
Us. Yes, yeah. Exactly. And they're weighing us down.
And then we get back pain.
Exactly. And then we get back pain and shoulder pain and neck pain.
Yeah.
Okay. So that's the deal. And we all have some amount of repression, some more than some less. It depends on how traumatic things were and how early in our life those traumas occurred. Okay. And so the thing of it is that it isn't the feelings that cause the pain. It's what we do to block the experience of the feelings. This isn't about acting out feelings. This is just experiencing. Go ahead.
It's not the feelings. It's what we do to block the experience of the feelings.
Exactly. It's what we do to block the experience of the feelings that causes the pain, not the feelings. Feelings are fine. When you're experiencing feelings, even anger, if you're really experiencing anger, it's like someone undid a valve and you can feel the anxiety draining out of your body and your thinking is clear and you can be emotionally intimate and available. But what happens is when we repress those feelings, now we're terrified to face them because they were terrifying as a kid, just developmentally and biologically, we couldn't experience them. No kid can. So now there's this anxiety that Freud called a signal anxiety, meaning an unacceptable feeling that we're terrified to face is about to break into conscious awareness. And Davanloo, and that anxiety is crippling. And that anxiety comes up in therapy. And what Davanloo discovered is that anxiety has 3 channels. One channel is into the striated muscle, the muscles that you can move voluntarily. So if you're looking at the pronator and supinator muscles, if you're looking at the intercostal and subdiaphragmatic muscles in the chest wall, you notice people taking a sigh, or you notice people wringing their hands, or you notice their legs moving in sort of a rhythmic fashion. That means the anxiety is channeling into the striated muscles. If it gets higher than that and can't be contained in the striated muscles, it channels into the smooth muscles, meaning the muscles of the autonomic nervous system. So it channels into the GI tract, and people get nausea or gastrointestinal problems or irritable bowel syndrome.
Wow.
And the third place it channels is into the cognitive functioning.
Wow.
It actually disrupts your cognitive functioning. You can't think as clearly. You lose track of conversations. If cognitive functioning continues at an intense level, the most intense form of cognitive disruption is you faint. And your head gets lowered and the blood goes to your brain and you recover. So in ISTDP, as we begin to look at painful things and that anxiety, that unconscious anxiety gets mobilized. Davanloo called it unconscious anxiety because you're unconscious of why you're anxious. You just know you're anxious, but you don't know why because it's unconscious. You don't go, oh, I'm anxious because I repressed all this anger at my mother, and that's why I carry all this tension in my shoulders, and that's why I worry so much. You can be aware of the anxiety, but where it's coming from is unconscious. And that's the job of therapy, is to make that unconscious anxiety conscious so you can experience the feelings as an adult. You're now capable of that you were incapable of experiencing as a kid. And so that's the basis of ISTDP. And so, for example, the hypothetical woman, although, it certainly is based on having seen a lot of women in 40 years of practice, who was beating up on herself, was treating her husband as if he was her mother. And indeed, he may be. We often marry people like who are our parents, so we can work things out. But she was treating him and everyone else in her life as if they couldn't handle her being angry or having her own needs. She felt she had to be an extension of everyone, the way she was an extension of her mother. And in therapy, she began to see that, no, people are different. Not everyone is your mother. People can handle that. And those are the people you want in your life. And people that can't handle that are the people you don't want in your life. And you can live without those people who can't handle your feelings, unlike when you were a kid and you couldn't live without your mother. You just can't. Infants are born with that instinct to bond. It's just an instinct. Yeah. And if that bonding doesn't happen, all sorts of problems develop. Okay, go ahead. Rose, you wanted to say something?
Could Tova put up that Tronic link again for people so that they can see?
Yeah, I put it. It's on our website. The still face.
The still face. Yeah.
Do you know about that, Marvin?
No. No, I don't.
Oh, really?
Talk about it. Wow.
Yeah, I don't know. So I can learn something too.
Well, yeah. We'll put it up again on this feed so that people can see the reaction of children, of babies, when the mother looks away or looks severe.
Oh, yeah. That's great.
Yeah.
I might be familiar with that. Yes.
I think you probably are. Yeah.
Okay. And so the thing is this.
Interrupt
all you want. This is great. I love the interruptions.
Can you give us another example to understand the attachment and the adulthood and how someone can easily move into a healing process with that? Like, I didn't understand how the woman dealt with her anger. Like I didn't really understand
what she did is she turned the anger on herself. She felt bad about herself.
Yes,
Instead of feeling angry at her husband, she said, I'm not a good wife. I should have sex more often. I should cook his favorite meals more often. I'm not a good wife. She started beating up on herself. Right. I don't really deserve a marriage. Instead of just feeling angry, like, hey, what the heck? You're coming in drunk at 2 a.m. You didn't call. Like, who wouldn't be angry?
Right.
But she blamed herself for everything that goes wrong, which is what the mother insisted.
Wow.
Otherwise, the mother's anxiety would go up. So it was adaptive as a kid.
Wow.
Other people, for example, your mother insisted you be or father insisted you be an extension of him, right? You were there to meet his needs. You had to major in this topic. You had to get good grades. You had to think a certain way. Wow. You had to feel a certain way. And the father couldn't tolerate it when you're not an extension of him. It's like you're the father's Valium, right? It's your job to manage the father's anxiety and say what the father wants to hear and do what the father wants you to do so the father won't be anxious. Okay, and then you just continue to do that as an adult. You become an extension of your boss, you become an extension of your husband or your wife, or whatever, instead of yourself. And this is tremendously stressful. Like, becoming an extension of someone was a way to avoid being angry at the father for being so narcissistic. And instead of being angry at the father, you accommodate the father. Or you try and change the father. If only I could change you, I won't have to strangle you for being a jerk.
So emotionally incestual in a way, and kind of like codependent in a way, like to be able to like separate. And we don't learn this except by having to go through it. We don't learn it. We're not taught it. It'd be great if it could be a course. I mean, this is the future for our grandkids, maybe, Marvin and Rose. So continue. This is fascinating. I really, you're explaining it very basic, and I'm very happy to hear that.
Good. That's great. That's great. Please interrupt with any questions or anything that isn't clear. So the thing of it is Davanloo didn't start out to develop a system of therapy to deal with chronic pain. His therapy was to help people work through their repressed feelings so they wouldn't be depressed and they wouldn't have panic attacks and they wouldn't have low self-esteem and their character change. But he found, as did I, that a byproduct of helping people experience their repressed feelings was that physical symptoms improved.
Wow.
Yes.
Like people didn't initially come to me for that. They came to me for depression, and most of them wouldn't mention physical symptoms because back then, in the 80s, people never thought of the connection.
Yeah.
They would just come in to deal with marital discord and then tell me, you know what, I used to have these horrible hive outbreaks, like at least once a week, and I haven't had one in 4 months since I've been seeing you. And this one woman, her heart condition, she had this non-specific heart condition. She had to wear heart monitors and all sorts of things, and they couldn't diagnose it. It went away. Another woman had painful menstruation. She actually had to be hospitalized on IV pain medication for some of her menstruations.
Wow.
And she said, my menstruations haven't been painful. Wow. So I learned about the mind-body connection indirectly just by doing therapy for people with sort of psychological problems. Yeah. Tremors cleared up, and the back pain cleared up. I have a whole list of things.
I'm sure.
If people came to me, occasionally people started coming to me specific, and I'm not a doctor, not a physician. I have a license in counseling, mental health counseling, so people never thought of me. But occasionally a woman came to me, which I was talking to Rose and Tova about, who was on multiple medications for massive GI disturbances, including narcotics. And she came in and said, I know this is emotional, and they want to give me more narcotics, and I don't want no narcotics. In 8 or 9 sessions, she was off all her meds, and she was symptom-free.
Wow. Yeah.
It's a different order of magnitude in character change. I mean, she even said, I know there's all these issues with my mother and my father that we haven't dealt with, but this is what I came to therapy for. Like, this is enough.
You don't mean character change like they're going to change the personality, but they're going to change their experience. So why are you saying character change?
That was Davanloo's term, and it's also a psychoanalytic term. Okay. But what it means is you can see, like in teaching videos that we show, you can see the person's face relaxing. You can see their presence in the world actually, their character actually changes in terms of they're more relaxed and more present and more themselves. You can just see the forehead isn't as furrowed. You can hear it in their vocal cords. Their voice lowers a few octaves because there isn't tension in the vocal cords, and they're just different. They don't even have to talk. Like I show one teaching video where I show the first session and then the last session, and you can just see in the last session, like, this is a different person. Wow. You can just see her presence, and that's what Davanloo's goal was. His goal was character change. His goal was no return of presenting symptoms in 5 years. Otherwise, it wasn't a successful therapy.
Wow.
For a lot of people, they don't want that. They just want their back to stop hurting, or they just don't want the migraines. This woman that I just talked about, where I showed the first and the last, her college counseling center couldn't believe we accomplished. She was bulimic. Severely bulimic. She couldn't keep anything down. She had migraines. She had tension headaches, and she had what we call explosive discharge. She would lose her temper, which, by the way, is not anger. If you're being mean or you're yelling, that's not anger. It means your anxiety's too high and you're discharging. And this is beyond the scope of a short time like this. But trust me, that's not anger. Anger is very connectful. Your thinking is clear. It's not like your mind is in a hurricane and you're discharging. That's all unconscious anxiety. Wow. And so her college counseling center, sent her to me for over summer vacation as an interim, but we fixed everything. And they couldn't believe it. And they did a follow-up for 5 years, and she had no migraines and she had no bulimia in 5 years. So amazing things can happen.
Wow.
Some people like there's
Joe is one of our greatest fans. Joe is one of our greatest fans.
That's Johannes.
Can you say something about the opposite, counterdependence or exaggerated independence?
Okay. So defiance is the same thing as compliance.
Defiance?
They're just defiance and compliance. Yeah, defiance and compliance are two sides of the same coin.
Yes, yes.
Whether you're giving somebody something they want and being compliant, or denying somebody something they want and being defiant, your life is still organized around what someone else wants.
Excellent.
And not around your own direction. I don't know if that answered his question. But either one is a defense against feelings.
Yeah.
Either one. If you're being compliant, you're not in touch with your feelings. You're focused on the other person's agenda instead of what you're feeling and thinking. If you're being defiant, you're not in touch with your feelings. You're focused on the other person's agenda, even if you're denying them what they want. The idea is to operate on your own path and in your own self-interest. And if you're being compliant or defiant, you can't do that. Another person is still controlling your life. Did that answer it?
He's talking about exaggerated independence.
Okay, I'm not sure what he means by that. I guess I interpreted it differently.
Yeah. No, well, I think
anything you're doing other than on your own path and operating in your own best interest is usually a defense.
This is what
you
Joe
should be connected with yourself and with what
you can read it on the screen.
The child who is defiant somehow goes against the attachment need. No, would that not be scary for the child who needs the parent to survive? Yes, but here's the thing. This is going to take us down a whole different path. It's a great question, Joe. Thank you. What Davanloo discovered and what he added to the mix of feelings are impulses. Like every feeling has an impulse. Every feeling has an impulse, which is simply an urge to act. So if you're feeling loving, you have the impulse to hug or smile or do something nice. If you're feeling fearful, you have the impulse to fight or flight, depending on the circumstances. If you're feeling sad, you have the impulse to grieve. If you're feeling remorseful, you have the impulse to make amends. And if you're feeling angry, you have the impulse to lash out, verbally, physically, or both, in a hurtful way, which is what makes anger such a difficult feeling to experience, especially when you're young, because you really want to hurt somebody. You want to say something mean, you want to do something mean, right? And so the thing of it is there are different ways to act out that impulse. One of the ways is to deny the parent what they want, right? You can stick it to your parents. And I've run into this in therapy so many times that people have depression or people aren't doing well in their life or people are flunking out of school. And when we get to the bottom of it, they're sticking it to their parents.
Wow.
They're making sure their parents don't feel good about them and don't feel good about their parenting. It's a way to deal with the impulse to be hurtful. And at the same time, I have to point out who's being hurt the most by that.
Right.
Like people tune that out. Okay, so you have a miserable life and your parents are wringing their hands and not feeling good about themselves. But that requires that you have a miserable life to stick it to your parents and get back at them. Is it really worth it to have a miserable life and be a failure just so your parents can't feel good? And you help people see that this is hurt, like you shoot yourself in the foot, okay, and your parents don't like it, but whose foot is really throbbing and bleeding and in pain? Is that really worth it?
It's like the martyr, being the martyr.
The thing about defiance is in order for defiance to work, to get back to Joe's question, the person has to tune out how hurtful it is to their life to be defiant. They actually have to tune that out. And your job as a therapist is to help them see that this is really hurting them more than their parents.
Right.
And defiance can start at a fairly early age. It often starts in adolescence, but it's really a crippling force in people's lives. Okay, Joe, did that do it? If not, try again.
Could I mention that age 2 is the start of defiance?
Pardon me?
Age
H2.
2. TWO.
TWO, what?
2. Yeah, when you
2.
start being defiant.
Oh, yeah, that's right. There's a healthy defiance. There's a healthy kind of separation.
Yes.
But it requires that your mother not abandon you.
Yeah.
You go out for short periods of time, but you're looking over your shoulder. That's right.
Yeah.
You're looking over your shoulder. You're kind of testing the world, and it's not always pretty.
It's safe. Yeah.
And the next thing is adolescence. Like when my daughter, I have a wonderful relationship with my daughter, who's now 39. But when she was 15, I'd walk into her room. Yes. Are you mad at me? Yes. What did I do? I don't know, but I hate you. And I go, well, okay, I just came in to say dinner's going to be ready in 10 minutes. That's also separation. That's also separation. And that's healthy. It's not always pretty, but it's healthy. So there are times where defiance can serve the purpose of growth and separating and individuating. It's when it becomes a way of life instead of a developmental phase, an attachment instead of something you pass through. That's when it's really destructive.
So my question is, so if people tend to choose attachment over authenticity, the healing is in themselves. They have to come to terms with something in themselves to heal. So how do we get, in simple words, how do we get the person to move away from the attachment, feel safe, feel like they can move away and accept authenticity? Like, what's that road? Is it the road from the head to the heart, or is it?
Yeah, in Istdp, it's helping them experience the feelings that they repressed in order to stay attached. As adults now, they have the capacity to experience what developmentally and biologically they couldn't experience as children. And so your job is now to go back and help them experience that they were really angry at their mother for rejecting them, that they were really angry at their mother for shaming them. Instead of feeling shamed as adults now, they can just feel angry and annoyed when people try and shame them. So in Istdp, it's going back to the original repressed feelings, sometimes going back to 3 or 4, or people, when the unconscious unlocks, which is a part of Istdp, people can actually recall standing in their crib. They can recall the color of the curtains in their nursery and the color of the carpet, because there's no time in the unconscious. There's no time, there's no gender, there's no negatives. If someone says for example, my classic example is a woman who came in the first session, and I said, "What brings you here for therapy?" And she says, "It's not my mother." So you don't have to be a psychologist to figure out what her problem was, right? There's no negatives in the unconscious.
So there's no time in the there's no time in the unconscious?
No, people can experience just they remember their brother coming in and trying to hit them through their crib. Well, one woman remembered her father burning her.
Like what Rose says, you have to unscaffold everything, take everything away, and then it's apparent.
Yeah, you take away the defenses. You help them drop their defenses. Yeah. You do 2 things. You're pressuring them for feeling. At the same time, you're sort of blocking their defenses. And eventually, the unconscious unlocks and people can re-experience what they developmentally couldn't experience as kids. That's the healing part. Yeah. And so but those things are terrifying to face. And Davanloo would say that. Can we face the truth of what's going on? He would say, so you might be terrified to face all of this, but together, you and your role, me and my role, we can face this together, and you can be a free man or you can be a free woman. Wow. It's terrifying to face, and it often takes someone in relationship with you to face it. It's not something that's easy to face alone.
Right.
Okay. Wow. Did that answer your question? Sorry.
Yeah.
Okay.
There's a I have not heard of Dr. David Cohen is actually a colleague of mine. He's a dentist who's actually very into body-mind work and understanding the teeth and the jaw and the connection.
Yeah.
And what's the Modigliani portrait?
I have no idea. The Galini portrait? I don't know that.
Yeah, it's part of the brain. It's a part of the brain that can portray, Marvin was saying that the unconscious is not past or present or future. So this is what David is talking about, is the area in our brain that actually can encapsulate that for us.
Oh,
so
okay.
Thank you for that, David.
Good.
Yeah, thank you. I had no idea.
I just want to
I'm
go
learning
back
a lot
to
today.
a couple of questions. There was a question from Susie,
Joe.
and it was a little bit, okay. If Schreiberner's study showed his clients were great therapists, why use a therapist who has their own resistance?
Yeah, that's true. That's a
Yeah.
good point. You want the best therapist, which may not be a therapist. But the truth of it is therapists have their own problems as well. We try and leave them at the door. And hopefully, if we're working on ourselves, there are less of those as we get older. But you're looking at two imperfect human beings working out a relationship. Davanloo used to say there's no difference between a client and a therapist.
Wow.
We just agree to play those roles once a week, where you get to be the client and I get to be the therapist, and
I
the
love
whole
that.
hour is focused on you and your healing. But I've had to go back and tell, and say to clients, I think my own stuff got in the way last week.
Yeah.
I won't go into it because it's your time, but here's what I did that wasn't very therapeutic, and it wasn't you. Let's see how you feel toward me, that I'm imperfect.
Wow.
Maybe you were looking for a perfect therapist and you want to keep looking, but that's not me.
Wow.
I don't always see things right away. I put that on my website. My website had a section, 5 reasons why you might want to look elsewhere. And one of them was, I don't always see things clearly as quickly as I would like. We're human.
Wow.
Okay.
But if both of you are open to that, it's okay. You're just working out a relationship between two people. That's all it is. Therapy has its parameters and its boundaries and all that. But you're right. And a lot of therapists have defenses.
Yeah.
Some of the most defended people I know are therapists, right?
Yeah. And Joe Smith has just brought that up. Can you bring that up, Tova?
Yeah.
So
And then I want to go
Marvin
back
can
to
see it?
Gail, I want to go back to answer your question in a minute, but this is what Joe brought up.
That's here. Can you mention 2 or 3 of the things you have done or experienced that has been the most healing and liberating for you personally?
Yeah.
Okay, I'll mention 2 things. When I was in training with Davanloo, and it was very intense training. We had to bring a 4-hour initial session, a video. It was 2 hours one-on-one while the rest of the group watched. It was a group of about 11 of us, psychiatrists and psychologists mostly, and we would do this from 8 in the morning till 6 in the evening, Thursday, Friday, Saturday, and most of Sunday, every other month during the academic year, and then an immersion course. I started to develop neck pains. I went to a chiropractor, and somehow it wasn't a good fit. I think it was the chiropractor. And someone suggested I try Rolfing, which is a form of deep tissue massage. And as the Rolfer started pushing on parts of my body, feelings would just come pouring out. Rage, like tears, like just massive sadness and tears when she would Rolf this part. And it makes sense. If you're repressing tears, there's a physical component to that where you're tensing your jaw, right? And then I started to develop visual hallucinations where I would actually see my mother or see my father, and I actually re-experienced my birth. There were like people standing over me in an old dingy ER with green surgical masks and gowns that I could see just like I could see the wall. And it was an amazing experience. And what I realized is that the training was stirring, since we're all the same, right? The training dealing with patients at deep levels, the training was stirring up feelings in me, and then my own defenses were kicking in, and the Rolfing released a lot of that.
Yeah.
So that was one incredibly healing thing I did. A meditation practice was also healing. And I did my master's thesis on Zen Buddhism and psychotherapy, which was what brought me to Rochester. There's a famous Zen center here in Rochester, and then I got a clinical internship at Rochester General Hospital and tried to make sense out of those 2 things. But my meditation has evolved, and it's one of the things I want to write about after I retire.
Wow.
As I get into these states where I'm starting to experience things before the age of 2, which are mostly physical. They aren't a lot mental at that age. And experiencing bonding problems with my mother and seeing my body like tense and convulse for maybe an hour. And I can tell it's old stuff. It's like an infant. That's how an infant processes things.
Wow.
When the meditation timer goes off, I'm fine. I actually feel relieved. And so one time, well, I got this sense that my mother had conveyed to me at an early age that there was something fundamentally wrong with me. Like I could feel it in my body.
Wow.
And I could picture her. And I could see how that affected my whole life. And I was trying to understand my feelings. Like, what am I feeling? I'm a therapist. I bet I'm mad. I bet I'm... And instead of having feelings, I experienced the part of me that was perfect before my mother. The part of me before my mother. I can't put like a date on it. It didn't seem like a calendar time. And then that everyone was perfect. And I experienced that. That lasted for a few days. But I don't know what it all means yet. There are just these isolated experiences. And there's no like, maybe somebody in the audience could help me put it together. What it all means. And that's partly what I want to do when I retire, is get into that form of meditation more.
Wow.
And see where it takes me. So meditation is great, especially mindfulness meditation, where you're just supposed to attend to whatever comes up without judging it. If it's painful, you live with the pain. If it's blissful, but you're not attached to anything. You're not saying that's a good thought, so I'm going to hold on to it, or that's an unpleasant thought, so I'm going to reject it. You're just watching it. Whoa. So those two things have been healing. Okay.
So Gail, hi Gail, I haven't seen you in a long time. Welcome, Baruch haba, welcome. What is the space between compliance and defiance?
I'm not sure. Try again. I'm not sure what she means by the space.
What is the space between compliance and defiance? You were talking about the two ends of the coin.
Oh yeah. Okay. They often occur simultaneously. Someone on the surface can be compliant. Yes, that's a good, yes, I'll do that. Yes, I'll do that. Yeah. And then they
but
don't.
It's really defiance, isn't it?
Yeah, underneath is like, I'm not going to.
But they weren't being honest. They weren't being honest. Their pattern was not to be honest, was to just.
Right. To give
it's not about dishonesty, though.
What is it about?
It's about having to be aware of what the other person wants.
Yes, so, that's all they're focused on, is what the other person wants, and not their own feelings.
Yeah. So see it more as being inauthentic rather than dishonest.
Yeah.
Well, sometimes it's conscious. Sometimes they're consciously sticking it to you, and sometimes they're not even aware that's what they're doing.
Wow.
Like even to help them be aware that they're being compliant. That's normal to them.
Yeah. Yeah.
And like this unconscious anxiety that we live with, that we try and manage by drinking too much and eating too much and binge watching too much. People become accustomed to it since it started at an early age, and they're not even aware that it's there until it's gone.
Right.
Like people who've had unlockings come back and they can go, oh, my shoulders are relaxed. I can't ever remember feeling this relaxed because we're just carrying it around with us. It's like there's this little stone in your shoe or something that you kind of tune out.
Wow. So JL, hi, JL's from Israel. I've not seen you on our show before, and I'm so happy to see your name here. She says ODD, and intermittent rage can be treated with the same therapy. What is ODD?
Obsessive, I don't know. Obsessive.
I don't know what ODD is, but an intermittent rage can be treated with the same therapy. She's asking.
Yes.
Yes, I'm sure that it can as well. Another question would be.
Intermittent rage is not anger, by the way.
What is intermittent rage?
Intermittent rage means your anxiety is too high and you're discharging your anxiety in the form of a temper tantrum. Let me give you a quick example. So I saw this guy, he was an accountant at the time, and we started to look at his anger, and he said, I push my anger away and don't deal with it. And I said, why? And he said, because it gets me into trouble. And I said, well, let's look at the worst trouble you've ever gotten into. Like, did you attack a therapist? I want to know, like, am I safe here? I want to know what the worst trouble is. And he was working his way through college at a supermarket, and the supervisor said something rude, and he pushed a shopping cart and hit the supervisor. And the supervisor pushed it back. He turned the supervisor upside down, threw him down on the ground, and stormed out of the store. Okay. I said, was the supervisor hurt? He said, no, I didn't do it that hard. I said, what happened? He said he lost his job. So later on in the session, I'm pushing him for his feelings, and he's making a fist. And I'm saying, so what's happening with that fist? And he said, I'm just so annoyed with you, I feel like hitting you. And I said, so he wasn't going to hit me. He just felt like it. That's the impulse, like feeling the impulse. If you can feel like, ooh, I just want to hit that guy, you're not going to do it. It's people who can't feel it who do it. So I said, oh, so you're really angry at me. He said, this is an anger. I said, what do you mean this is an anger? You feel like hitting me. He said, this feels good. And I said, what do you mean it feels good? He says, my thinking is clear and I feel connected to you and I feel like we can talk about what I'm angry about. And I said, how did that compare with what happened at the supermarket when you were working your way through college? He said, it was like my mind was in a hurricane and I didn't have good control over what I was thinking or feeling. I couldn't think straight.
Wow.
That's anxiety. That's anxiety. And intermittent rage is anxiety. And so it's that unconscious anxiety. And some people deal with it by acting it out, kicking the screen door or punching the wall or saying
so that's what they
something
told
rude.
us. People told us it's called ODD is oppositional defiant disorder.
Yeah, that's right.
Okay.
And with oppositional defiant disorder, you have to help the patient see that this is hurting them more than the people that they're defying. And in order to get back at your parents, you have to flunk out of school and get depressed to stick it to your parents. And is that really worth it to you?
I wonder if like a lot of men that are abusive just go through this, like they're not aware of it and become abusive to their wives and then they're like, oh my God, like it's like something comes over them and they're out of control.
Anxiety gets too high. The wife is someone in their unconscious that they haven't faced. And if they can face that, for example, if people have had a lot of abandonment, when I end a session, you can tell that because I end a session and people go, well, what do I do? Give me some advice. Or so the next session, I wait 15 minutes and I say, okay, I'm going to end the session in 15 minutes. How do you feel about that? And they feel the same abandonment they did as a kid.
Wow.
That I'm abandoning her to go home to her abusive husband the way her mother abandoned her with the abusive father.
Right.
And they're angry at me for that. And they can start feeling angry at me because I'm safer than the mother. And then it transfers to the mother. And they're realizing they were angry at their mother, but I'm a safer figure. And then I say, okay, well, once they're in touch with their anger, I say, okay, well, what if I said, great, I'll just cancel out my whole day and I'll come home with you and help you deal with your husband. And they go, whoa, it's like, let's have some boundaries here. It's all say you have mixed feelings, which is important for people to understand. There's a part of you angry that I'm going to end the session at 3:00 like we planned. And there's another part of you would be angrier if I didn't have professional boundaries.
Wow.
If I cross those boundaries. And so you have feelings on both sides. Again, it's just about experiencing the feelings. And then they can have mixed feelings toward the parents. It isn't just the anger. Underneath the anger is love for the parents.
Right.
Sadness that there couldn't be more closeness. The anger often sits on top of that.
Right.
And when you help them experience the anger, all these other feelings, sadness and love, come to the surface. So it isn't like you want to get stuck in anger the rest of your life.
Right.
But you want to feel it. Okay, sorry, go.
So excellent. Martin Liddell, who I think he might be a therapist, Martin. Maybe. Anyway, where do Istdp and meditation meet?
If you talk to Dad
in your next book.
Yeah, that's it.
Well said, brother.
Here's the thing. They both have their place. They both have their place, but anything can be used as a defense. So, for example, my name got passed around in circles of meditation teachers who would come to me for therapy. And these are people who could get into deep states of meditation, samadhi it's called, and then they walk off the mat and have terrible relationships. And one guy, I said, so how did you feel toward your wife? And he goes into a deep state of meditation right there instantly. It was a defense. It was a way not to feel feelings toward his wife. He just, boom.
Wow.
And he couldn't hear me. He was in such a deep state of meditation that he couldn't hear me. And I started yelling at him. I actually moved into his space, which I learned in boot camp when I was in the military. I mean, it wasn't threatening. And I kept saying, you're in a trance, you're in a trance. And if someone came in, they would be sure that I was the patient and not him. And he finally came out of it. And he said, what the fuck do you want with me anyway? And then I was going, oh, we're in business again. We can talk. And so meditation can be used as a defense, as can therapy.
Wow.
It can be used as a defense against feelings, as can therapy. People can have wonderful talks with their therapist for 10 years and really enjoy themselves, but not get anything out of the work.
Excellent.
You know?
Exactly. Excellent.
Okay. So therapy can be used as a form of defense as well. Yeah. In fact, our training as therapists, our training becomes an extra layer of character defense. If you're seeing a therapist as a patient, that therapist training is an extra layer of character defense and can become an extra layer of defense in sessions with clients.
Right.
Yeah.
Okay.
Amazing. Any topic you want to discuss, Rose?
Well, it's Susie.
Oh, Susie's question.
Yeah, can you bring that one up? Because that's good.
I'm intrigued by the role and vocation of the therapist. What stops the therapist enacting all their own patterns and issues with their client and solving their emotions and not the client's? That happens. Mm-hmm. That actually happens. And the idea is the therapist is supposed to catch that.
Yeah.
And we don't always do it.
Can I give an example of that? I can give an example of that. So sometimes I work with patients who have trouble walking, and because my mother had MS and she didn't walk, I feel myself, wanting to like push a little bit, like a football coach. You got to do it. You got to do it. You got to do it. And I realize this, and I understand that. Of course, I want them to do it, and of course, I believe I can do it. And I've met people who've done it. But these people have their own time frame. And I just became very aware of that this week, working with a few women. And it's fascinating because I'm aware of it. It doesn't make me a better or a worse therapist, but I think I have to really be where the person's at and give them the space to tell me, to create that communication. Because sometimes they won't tell you. And I feel that. I'm like, was I a little bit too much? And they'll be like, yeah. Or they'll be like, no. Like, you want them to tell you, yeah, you were a jerk. Great. I won't do it next time. But not everybody's ready to tell you. And then it becomes a little drama. That's what I feel.
Well, then you could confront them for their defiance, for their compliance. You can say, I don't think you're being honest with me.
Yeah.
That would be, but yeah, that's right. And me too. That I learned about myself by being a therapist. And there are some people that many years ago, especially, that I wasn't up to the task at hand because of my own stuff getting in the way. So the idea would be to keep shopping around for a therapist until you find one that their defenses and your defenses are a good match.
Very well.
And then you'll get somewhere.
In the beginning of core training, we're always told to make sure that there's a space in our own minds and our own heads for our patient that is not connected to our own problems. And it's important for every therapist to have supervision and to also have their own therapy, because otherwise you won't have a space, because you'll be projecting all along.
Exactly.
You'll be looking at what the patient is doing and seeing it as a judgment on you, etc. Or using the patient as your couch. How would you put it, Marvin? Like,
yes, I agree.
Yeah,
using the therapist, using the patient as an extension of you to manage your anxiety and make you feel good about yourself. And right, that's right,
exactly.
That's right.
Yeah.
And so the idea is to keep shopping around. We're all crazy therapists. We're all crazy like everyone else, and eventually you'll find one that's a good fit. But don't. I've had people that have been in bad therapy for like, go.
Ask, what is the difference between you and Dr. Davanloo?
Oh my God. That's the thing. I learned a lot from Dr. Davanloo, and I would start off by imitating him. He had this Iranian, French-Canadian accent. So I would look at my videos and I would say, let's look to this. He would say, let's look to this, and let's to see how you feel. And probably, he would say instead of probably. And vicious instead of vicious. There's this vicious, and that's you just start off imitating someone, but eventually it has to be incorporated as your own.
Yeah.
And so I have my own way of doing it that's different than his, but it took some time. Like musicians, you start off imitating a musician,
Yeah.
and eventually develop your own style.
Well, it's repetitive intelligence, so then
Yeah.
it becomes. But we have a lot of people on watching our show, and so you obviously have a lot of people that want to hear from you. So it's you've unfolded into your own, as we say, your own neshama, which is your own soul. So Joe Smith says, piggybacking off of Avishai, what is your take on the term masters being used to well-known teachers and attributed to you as well? Are you a master?
No, I'm not. I'm a work in progress. And I envision being a work in progress on my deathbed. I'm not a master. I'm just Marvin.
Yeah.
I'm an imperfect human being, and trying to work out relationships. That's it.
It's like when Moses said to God, no, I don't want that job. I just want to, and then when he finally took the job, he was like, all right, just show me the way. Like, I'm not interested in being you. Just show me the way.
Exactly. And we're all looking for masters. We all have this fantasy that there are these enlightened beings walking around.
Well, isn't the best therapist is one that can mirror the client?
Be present. Mirroring can become an attachment. You can just be into mirroring, but to be present with what's happening in this very moment between you and the client, both between you and the client and within the client and within yourself. And it isn't like you have to be free of neurosis, but you have to be conscious of what's going on. My first supervisor, Bernie Schwartz, tried to tell us that in 1979, the interns, that if your client is different than you or isn't moving the way you would want them to, you're going to have feelings. You're going to have prejudices. You're going to have anger. And he said, your job is to be aware of that, because if you're not aware of it, it will seep into your therapy. And we were all being a little defensive. And he said, that book, I'm okay, you're okay? And he said, yes. He said it should be, I'm okay and you're barely tolerable, even under optimal conditions.
And what a name for a book. I mean, we met John Fredrickson. What a name. I mean, I wish I would have made that up myself, like The Lies We Tell Ourselves. What an incredible name for a book.
Yeah.
So
we're all imperfect.
Yes.
Including therapists, right?
Julie says, how do you find a good Istdp therapist, especially for someone who doesn't think they have anger issues?
Oh, okay. Well, you would be the only human being that didn't have anger issues that I've ever met. So
she doesn't need therapy, does she?
Anger is not the problem. It's not facing it that creates everyone's symptoms. What we do to not face that anger is what creates anger itself.
I want you to say that again. Emotions, feelings are not the problem.
No, not problematic at all.
Are not the problem.
It's what we do to avoid experiencing them.
It is what we do to avoid
experiencing them that creates our symptoms, both emotional and physical.
Experiencing them. I really.
Rose will tell you this is the basis of Istdp, right, Rose? That it isn't. It's the defenses that we use against the feelings that are problematic.
Right, and our ego comes in, and
it's a punitive part that comes in.
Right. Yeah. What does punitive mean again?
Pardon?
The word punitive, I'm blanking. The word punitive.
Marvin?
Well, that's a whole different thing, but the part of us that's engaged in self-sabotage and self-defeat is what Davanloo called the punitive superego. And the punitive superego runs until we deal with what's going on underneath. The punitive superego determines the course of our lives way more than it should.
Wow.
We eat too much, we binge too much, we don't do what's good for us.
Judgmental and critical.
Right.
Self-criticism and that,
Wow.
Yeah. Or we're judgmental and critical in a way that it leaves us alone.
Yeah. Benjamin's got a nice question for you too.
Let's see. Do you still feel embarrassment reflecting back on your work a few years back? I noticed it in my own journey as a young therapist. Yeah, and pain and sadness. Like I think of all the people that probably are still running around in pain because I wasn't up to the task at hand. It's partly why I'm doing this. I'm trying to give back and trying to help as many people be good therapists in the world as possible. Yeah, it's one of the things we have to accept in our profession.
But you can't be critical of yourself, Marvin. You have to be accepting. You did the best you could.
Yeah, there's a difference between it's so painful that I couldn't help that person, which is healthy remorse, versus I'm a terrible human being and a terrible therapist and don't deserve to be happy, which is a defense.
Right.
And one is, like I had one meditation where all the people I was mean to in my life, some of them probably didn't even realize it because I can be mean in a subtle way, started flashing in front of my eyes. and I set a timer and I don't move till the timer goes off, because I would have gladly just ended that meditation right there. And some of them I didn't recognize right away, but I knew like dozens, I don't know how many. It was excruciatingly painful. And when the meditation stopped, I just doubled over in pain and said, I'm so sorry. I'm so sorry. I was like crying. My face was contorted. That's healing pain. That doesn't mean I'm a bad person. It means I do things that I have remorse about.
Wow.
And that kind of remorse is painful, but it's healthy. Like when you apologize, if you sincerely feel bad and you apologize to someone, it's much more healing for the person apologizing than the person apologized to.
Yeah.
And that's painful, and that's different than beating up on yourself. If you're beating up on yourself, then you want to look at that. Go.
Air and Joe mentioned healthy guilt. So can you elaborate healthy guilt?
Yes. When people realize they wanted to hurt their parents, there's an incredible guilt, like their face is contorted. And Davanloo actually charted the biological pathway of healthy guilt. It's this painful feeling that comes up through the chest into the neck. And it's an important part of healing to feel that guilt. It's like you're doubled over in pain, sort of like I was in that meditation. He would not do therapy with people if they had upper respiratory infection. He postponed the session because it would block that biological pathway for guilt. And that guilt is healing. Whereas I'm a terrible human being and I deserve to be beaten up is not healing at all. So it depends on where the guilt is coming from.
Wow.
It's the most painful thing. You can't imagine it. And on the other side, you just feel like liberated.
Yeah. There's so much, Marvin, that needs to be connected together about what ISTDP does, isn't there? Like it's an emerging therapy, really, although it's around for 50 years. It's still emerging, isn't it? And
yeah, it was obscure when I started studying it. Most people didn't know about it, and now it seems to be coming into vogue. And there are teachers all over the world, literally.
Yes.
All over the world.
Yeah.
Unbelievable.
Even down here in Australia.
Yes, you have quite a few good practitioners and teachers in Australia.
We have.
And in Israel as well. You are.
Yeah.
Very popular here. Suniva asks, what are your best advices to become an efficient ISTDP therapist?
Okay. Shop around for someone to train with. And again, the same thing with the therapist. Not everyone's going to be a good fit. I would give a half an hour in my office for free just to see if we were a good fit. Chemistry is important beyond technical skills. The second thing is once you find someone, videotape your sessions, at least for 4 or 5 years. It's the only way to really learn ISTDP well, and let someone look over your shoulder and watch your videos. It's the most humiliating thing.
Wow.
I remember bringing a 4-hour session to Davanloo, and in the first minute, it was obvious that it went off in the wrong direction, and the whole 4 hours, it's so humiliating. And I would watch myself projecting. I would be saying to the patient, you're very angry at me right now. And I'm looking at the video and I'm going, oh no, I'm the one that's angry at them. It's like your own psychopathology is on the screen. Like the patient is who they are, right? They're depressed or they're okay. But why am I interrupting? And why did I change the subject? And why am I seeing something that's right in front of my eyes? So what it takes to become a good ISTDP therapist is the same thing that it takes to become a functional human being.
Wow.
You're facing your own stuff, and video is the best way to do that. It's totally humiliating, but it's the best way to learn.
It is. It's very humiliating, isn't it?
And the actual course, because I was thinking of taking it, I mean, it's very intense. It's like 2, 3, 4, 5 years. It's not, to be a full-fledged, and Rose is always doing trainings and follow-ups and
it's a go ahead.
Yeah, you need to be refreshed all the time.
And you learn different things from different people. Like everyone has their own version of ISTDP. And everyone brings their own personality. And so you learn different things from different people. And so, there are aspects of ISTDP that can integrate into anyone's approach to therapy. We don't have enough time to go into this, but the whole thing, like the channels of anxiety, to know what it means when there isn't striated muscle tension would be important for any therapist, for any approach. And so I have people in supervision who've had years of training in EMDR and Ericksonian and CBT, and I'm not having them throw that out. I'm having them start with that, and then we begin to integrate ISTDP into what they're doing to whatever extent they feel it's helpful. It's not an either-or thing. You don't have to either become an ISTDP therapist or not. You can take aspects of ISTDP that are meaningful for you and integrate them into what you're doing, which is my main focus right now in my training. And so you don't have to do either or. You can just begin to integrate, and when you've integrated enough, that might be fine for you. You don't have to do
I'm going on the line to say this in public, but as a chiropractor for over 30 years, I don't believe people need more than 3 or 4 or 5 adjustments at the most. They need exercise and stretching, and they mostly, if it's chronic, it's emotional. They need, so I feel like that's where I've integrated the chiropractic and the body-mind therapy. And
exactly. And to me, that's so powerful, not to throw all that out and try and become an ISTDP therapist. Just become a really good therapist based on what that means to you and what feels right to you, not on someone else's criteria.
Right.
And so you might not need 3 or 4 years of training. Maybe you'll just start integrating it into what you're doing gradually and see how that goes.
Hang out with Rose a little bit, and
there you go.
Just having training on the ground.
Hanging out with Rose is a good thing, not just because she's an ISTDP therapist. So.
Yeah. She's a nurse and a midwife, and she brings together all these 3 things, and it looks so powerful.
I know it is.
Really.
And that's it. You've integrated it all instead of throwing out your training. You've integrated.
Oh, absolutely. Yeah. I think it gives you insight.
Yes.
Yeah.
It does. So instead of becoming an ISTDP, go back to that question, instead of becoming an ISTDP therapist, just become the best therapist that you can and see how ISTDP fits into that for you.
Yes.
Rather than, I took ISTDP off my website. I just said short-term therapy. That was it.
Okay. Well, it sounds very complicated, doesn't it? And who's going to remember those initials, ISTDP?
I agree. I agree.
Yeah. But more and more people are beginning to realize that if they want to actually get rid of their problems, that they need to go down that road of looking at their defenses and looking at their anxiety. And, of course, this is a model that just has that as its masthead, really, isn't it?
That's right.
Yeah.
That's the whole thing, making the unconscious conscious, and that's the healing.
Yeah. Could I just add, as we're finishing up, that the saying is Freud. What was it? Freud exposed the unconscious, and Davanloo. What's that saying?
Learned how to use it therapeutically or something. Something like that.
Yeah. Freud opened us to the unconscious. Davanloo opened it up. Yeah, right. Opened it up. Yeah.
Wow.
Yeah. And Davanloo said that. He said he did not develop a new form of therapy. His technique, he said, added to the body of psychoanalytic knowledge, even though it was a radical departure in terms of the technique.
Yeah, exactly.
I find it fascinating that he's from Iran. I really do. I can't imagine the kind of childhood he had that drew him to this work, which is, it's something in him moved him towards this work. It's just so powerful. So
He
powerful.
said he did it. He said he did it intuitively. He
Yes.
arrived at Istdp intuitively, and then devised all these terms that should
Wow.
help the rest of us see it. By the way, one other thing I thought about him after our conversation:
Yeah.
his parents had a large orange plantation in Iran. And he said he was Farsi and not Iranian when I asked him. I don't know what that means.
No, and he must have had a past life.
Ask Pedgman. Is Pedgman still there?
Benjamin, who's Benjamin?
No, Pedgman.
Oh, Benjamin.
Yes. He speaks Farsi.
Where's Benjamin from?
Iran.
Oh, he is? Neat.
Yeah.
Are you still there, Pedgman?
He's in Queensland.
Oh, okay.
Yeah.
So
he's one of my colleagues, I suppose you would say.
Oh, okay. Yeah. Well, ask him. I've always wondered what that meant. Every person I met who immigrated from Iran wouldn't own being Iranian. They would say they were Persian.
Well,
no, I'm not Iranian. I'm Persian.
Oh, good. You're here, Pedgman. So tell Marvin about Farsi and how. There you are.
Iranian means emphasizing religion. Wow. Persian means emphasizing nationalism.
Oh, thank you, Pedgman.
Fascinating.
Wow. Thank you. Thank you.
That makes sense, doesn't it? Because I was thinking it was the British that probably imposed it on them, the word.
Yeah, that could be. Yeah.
Yeah. Yeah. And who'd want to have a British name in the Middle East?
I agree. Or anywhere.
Or anywhere. Exactly. If you're not British.
Other than the UK, right?
When we get into politics or talk about Corona, and I did both. We did both.
Yeah.
Marvin,
we have to have you back. Yeah, go ahead.
I'd love to be back. This was This was so much fun.
Yeah.
Great questions.
It has been, Marvin. It's been really lovely. And thank you so much. Anyone who wants to inquire any further, we've got more information on our TMS Roundtable page.
Yes.
And have a good day, all of you.
We also wanted anyone to like or follow our TMS Roundtable page, and then you'll get weekly updates and
of who's coming on.
You're such an incredible student, because we spoke the other night, and then we sent you the movie All the Rage, and you watched it, and you just you got it. You figured out the connection of what brought Rose and I together, which is sort of the TMS and Istdp, and you're just really thrilled to have you. You're just and I can't wait till your book comes out. Maybe you can come on and we can do some meditation together. And
whatever. Let me know. I'd be glad to come back. This was great. I enjoyed meeting both of you. I enjoyed indirectly meeting the viewers. So thank you.
Yeah, and thank you for showing up with your granddaughter on the picture.
Oh, thanks. That's my new life. That's one of the reasons I'm retiring also. So
it's a good reason. It's a good next chapter. Good next chapter. Yes. So we'll be in touch. If anyone has questions, can they contact you with somehow?
They can. Marvin at marvinskorman.com.
Okay, I'll send them your email. Wonderful.
They can Google me and they'll get my email that way. And
Thank you.
No problem.
So
Anyone, no charge.
So
just reach out with questions or concerns, and I'm happy to respond.
Great. Terrific.
Thanks, Marvin. Thank you so
Rose,
much.
yeah. Rose, I love Monday nights because I love hanging out with you here, Rose.
It's Tuesday morning here.
Tuesday morning.
6:15.
Yeah.
It's not even daylight yet.
You're good in the morning, Rose. My eyes are starting to droop here at night. Thanks so much, Marvin. Good to see you again, and we'll be back soon.
Thank you.
Bye.
Thank you.
Bye.